330,000 teachers and support staff have been vaccinated so far out of a set of over 582,000. This as the July 8th deadline looms to vaccinate the basic education sector. Joining me now to talk about this is the National Coordinator for the Vaccination Program, Chief Director at the Department of Basic Education, Enock Rabotapi, as well as SARTU Media Officer Nomusa Cembi, as well as the Acting Deputy Vice Chancellor for Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. You're part of the conversation tonight on Twitter at Newzroom 405, on WhatsApp 072-110-5584. Nomusa, good evening and thank you for your time. Let's start with you, and good evening to you all, gentlemen as well. Thank you very much for joining us. Let's start with SARTU. 2 weeks ago, you said you were concerned but satisfied with the rollout. Where are you sitting 2 weeks later, that is today, as far as the concerns that you were raising, particularly around KwaZulu-Natal and the rollout there and everywhere else in the country?
Good evening and good evening to viewers. Yes, 2 weeks ago when this program started, there were hitches here and there, especially in areas like in KwaZulu-Natal, where you found that the area is vast and there were fewer sites, vaccination sites. However, those problems were dealt with as the program went along, and at the moment we can say that we are fairly fine with what is happening. But although, for instance, in KwaZulu-Natal now, most of the teachers have been vaccinated, but we got problems earlier today that the support staff was being turned away in some of the places because their names were not there. But we hope this problem will be sorted, and perhaps by tomorrow things will run smooth.
Yeah. If we covered 330,000 in 2 weeks, do you think we'll cover the rest of the 300 in 2 days, or must we forget about hitting target?
We are confident that we'll cover the rest within the 2 days, and judging by what we see, for instance, in places like in the Free State, they ran out because teachers were there and education personnel were there. They ran out yesterday, and we understand that tomorrow more vaccines will be brought in. It's not through the fact that teachers are not coming forth, but in some places you find that the vaccines are not there.
All right, let's have you respond to that then. The teachers are showing up in numbers, but the vaccines are not there.
Thank you, Thabo, and good evening to the listeners. It's indeed true that at the beginning of the process, like in any other process, you would have some teething problems. We have had the first allocation of doses when the program started. We started with an allocation of 300,000 doses. Those doses went very quickly by the second day. The first day of the 23rd went a bit slower, with challenges with the EBDS system and people not appearing on the system. And then also the delivery of vaccines. They were delivered a bit late on the first day in some of the sites. There were a few sites where there were issues with staff, where there were either not enough nurses on site, not enough vaccination sites to deal with the crowds. But those problems, by the second day, we were able to sort them out. So the problem started by Monday the 28th, where some of the vaccination sites started running out of vaccinations, but the Department of Health was very swift in delivering additional doses of vaccines, and that's where we saw the program starting to pick up again. And by last week Thursday, which was the first, we started to include additional categories like the staff of your independent schools, your food handlers, your cleaners, security personnel. These were additional staff members that were included, and so we had to get an additional allocation of vaccines.
Yeah. The question, though, is more around the teachers that are showing up, and you're not sufficiently catering for the rise in numbers in particular. I think we have lost your audio there. Enock, I don't know if you've muted yourself. If you can, please. Yeah, okay, we'll try and get back to Enock. I don't know if his audio has been muted. But, Prof, let me bring you in here, and let's talk about this question of vaccine hesitancy. Last week, Gauteng announced that nearly 9,000 teachers and support staff did not want to be vaccinated. I mean, the question of vaccine hesitancy, are we still at that stage? Have we not adequately addressed some of the questions and the concerns that people have?
Good evening, Thabo, and to the viewers and to the panelists as well. I think that, the vaccine rollout is really posing a slightly new challenge for us in terms of, when we're dealing with this notion of hesitancy or willingness to accept the vaccine. And, I find that we are having to really listen to what people are saying. We're having to listen to what their concerns are, what their questions are. And, if you look in the Department of Health nationally, even in the provinces, they are constantly trying to scout through social media, through some rapid surveys, telephone surveys, to understand the perceptions, the questions that people have, in order to kind of craft messages for communication. Now, of course, for each population that we target, they would have their own unique challenges. And I think that even for the teachers, it was important to make sure that, in spite of the short space of time that we had to roll out the vaccines, we needed to actually understand the issues that they have. I personally don't think that having 10,000 teachers in Gauteng hesitate to take the vaccine in itself is a bad thing, but it does require dialogue.
Right.
And that dialogue needs to happen very quickly.
Let's talk about that dialogue. I mean, what we are communicating so far, is it sufficient? For example, we'll talk about the benefits of getting vaccinated, or maybe the approach that we would take, for example, is to get politicians vaccinated, get traditional leaders vaccinated, get faith-based leaders vaccinated. We seem to think, or at least government seems to think, that that is adequate enough to convince the population that, of course, this can be done.
Yeah, no, I think that there are multiple strategies, but one of the things that really works at the moment, maybe two things that I want to highlight, is that, the more people vaccinate, then it means that friends and relatives are also vaccinating, and people can then have a first-hand experience of the vaccine, and they're not necessarily going to speak only on the basis of what they gather from social media and all these sort of messages that are circulating, driven by, misinformation agendas. And that first-hand experience is really important in terms of strengthening the dialogue. Secondly, you need to have trusted sources, and we are in a context, Thabo, of a lot of mistrust of the government, but also of science, because science is seen as something that is from the West and the global North, and it's not easy to trust. And other people, of course, within that landscape are exploiting those doubts that people are expressing. So we are finding that, if you now invite people like people who play a role like GPs, who play a more trusted role for individuals, and they explain to the teachers, to the older senior citizens, in terms of the pros and cons of the vaccine, the types of vaccine, which one would be suitable. I mean, this is making it a lot easier. It's now my go-to strategy to say that, speak to someone who has vaccinated, speak to your GP, speak to someone that you can trust, who has had first-hand experience and has reliable information.
All right, Enock Rabotapi, Nomusa Cembi, as well as Professor Mosa Moshabela, they stay with us tonight on the conversation on the rollout of vaccines for our educators and staff that supports our educators, but also a call from SARTU to extend this now beyond just the school environment, but also to the post-school sector, as well as looking at some ECD centers as well, and how that could benefit our rollout program in South Africa. Let us know what your officer, Nomusa Cembi, as well as the acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal, Professor Mosa Moshabela. Nomusa, talk to me then about the degree and the level of teacher hesitancy to take up the vaccines, and how are you as the union addressing that particular question?
Yes, we understand, or we're being told by the media that there is quite a high level of hesitancy. But to be honest, we have not seen it. Yes, we have learned that in Gauteng, close to 10,000 teachers and support personnel are not taking the vaccine. We do not know where they drew that data from, because we have not seen that at ground level. Yes, we have been motivating our members to take the vaccine, and we started with the leadership of the union taking the vaccine, and then we communicated this on social media just for members to see that our leaders are taking the vaccine, and they are encouraging members to do the same. And we not only worked as SATU, we also engaged other teacher unions. We've been issuing statements together with the other teacher unions. We've been putting on social media platforms clips of members and teachers in general who have taken the vaccine, and we are encouraging our members or teachers to be vaccine ambassadors and to help people in their communities to register, because we were in a better position in that we could go and be vaccinated without necessarily going through the system of registering. They just took our data and registered us. So we felt that our members should go to their communities and make sure that the elderly who have not been registered are encouraged or are assisted by our members and teachers in general to register.
Give us more information on the rationale behind your call to extend the vaccination beyond just the teachers and get to the post-school sector as well.
We felt that it didn't sound well that the teachers in the early childhood development sector were not part of this. We regard them as teachers. We know that they are under the social Department of Social Development, and we feel that even though they are under the Department of Social Development, what they are doing is education. They are the ones who interact with members from various families and on a daily basis, and that puts them at risk of contracting the disease. We also felt that even those in the TVET sector, they are lecturers. They interact with learners who come from different families, different places, far and wide, on a daily basis. So their lives are at risk as the lives of teachers who are in the basic education sector.
Yes.
So we committed to engage with the Department of Higher Education and Training to ensure that lecturers in these sectors are vaccinated, as well as those in the early childhood development sector.
Yeah. Enock, as far as the rollout to teachers and the vaccine hesitancy, but also, again, just addressed for us the issue of undersupply of vaccines where the numbers are great and demand is quite high.
Yes, the issue of the undersupply of the vaccines, the Department of Health does have sufficient vaccines for the sector. Our experience is that in certain sites, because of more people turning up at the sites, because how we have been operating is that our provinces have been communicating with our educators to inform them to visit the vaccination site on a particular day according to a specified schedule. Now, there have been instances where schedules were not adhered to, so you have a situation where more educators than expected turned up at particular sites. And when that happens, obviously the number of vaccines at that particular site would be depleted. But we were able to mitigate the situation through mobilizing vaccines from neighboring sites to complement some of the sites where the vaccines have run out. So there is no overall shortage. It was just a question of allocations on specific days. As I've indicated, we have received additional doses from the Department of Health, and we are confident that we will be able to cover the entire population that we have identified.
Yeah, indeed. Prof, let's address some of these issues then that come up. I mean, one of the issues, people would say, let's ask the question of the health workers and the teachers who have been vaccinated so far. What are the side effects that we have seen?
Yeah, no, it's a very important question, Thabo. I think that, as you correctly say, drawing from the actual experience that we have is much better than just kind of discussing, the challenges conceptually and in theory. I think for the most part, most people so far have been fine with the vaccination. The commonest sort of challenges people report have to do with the sort of immediate period after vaccination, and that has to do with pain on the arm and maybe some tiredness, and some people feeling a little bit sick with some headache and nausea or body pains. But after about 24, maximum 48 hours, most people report that they are fine. I think that it's only really rare occasions where people tend to have problems that need attention. And drawing from healthcare workers, of course, we've seen the report from Sisonke that was basically giving us a summary of the issues that they've gathered, and that there have been some episodes, for example, the concerns around clots. There have been some minor episodes that they've picked up that they've all managed and addressed, and there hasn't been any major complications beyond that. And for the most part, from the teachers' vaccination, there's a lot of enthusiasm. There are a few people who have been reported to have questions and concerns. And, we've been saying to open up the dialogue, listen to their concerns. And if at the end of the day we hit 50%, 60% of people vaccinated, we don't have major problems, let's carry on. And if, getting to about 80% is going to be hard, but, like we did with the healthcare workers, we didn't have to wait until we've met a target of 100% or even 80%. Once we hit 50%, 60%, it was then okay to start, continue dealing with the rest as time goes on, because the late adopters, you'll have them, and a small percentage, maybe 10% or so, will definitely say no, they don't want to get vaccinated for their own valid reasons. We need to create space for that.
Yeah.
But other than that, we need to aim for a good percentage of about 60-70%.
Our president has been very clear. I hope he still holds that same view that no one, and he repeated and said, absolutely no one will be forced to take these vaccines. However, there are concerns that were raised or are being raised by those who are vaccinated to say, well, we are vaccinated, those who are not vaccinated or the unvaccinated will endanger our lives. I mean, just hear that. Is that even a possibility?
Yeah, no, absolutely. I think that, and we are seeing it, all over the world now. It's about the question of, you know, there's a sense that people who are refusing to vaccinate are being reckless, and we have to distinguish people who are, hesitating and unsure and on the fence because of concerns that they have. Those have to be dealt with. And also you'll have a group of people who may have been misinformed, and with correct information over some time, they can change their perception. But there will be a small group of people, and we allow it that for that space in all forms of immunization, who would not want it for their own valid reasons, be religious, be medical, or whatever reason that they may have. So we have to create space for that, and we will get to a point where we have to discuss how we manage it, whether, what precautions need to be taken. But in my own view, I think that we don't have to worry about it if it's a small percentage. Remember, the population herd immunity, that those who are vaccinated will also protect the small percentage of people who are not vaccinated. It will come into play, and we should just allow that, a time will come for that. Right now, of course, it's a concern because it's still a large majority that are not vaccinated. But when we hit high numbers like we are seeing in other countries where they're already hitting 80%, then we should be coming closer to population herd immunity.
Enock Rabotapi, Nomusa Cembi, as well as Professor Mosa Moshabela with us tonight here on In Focus, and the conversation is on the vaccine hesitancy in the teacher population in the country, and whether or not that target will be hit. Enock, what are your sentiments? What's your thinking as the department, as far as the coordination is concerned, seeing that there is a number that has taken up and a number that has not taken up the vaccines? I mean, at what point do you say, let's open up to other sectors?
Well, basically, the decision is not the Department of Basic Education. It's the decision of the Department of Health to decide which sectors can now be prioritized. They started with the health care workers, and now the target was now with the education sector, and I think they will be moving on now to safety and security. But our responsibility as the department is to ensure that with regard to the Department of Basic Education, all the necessary personnel that needs to be vaccinated is encouraged to vaccinate. And that's why we've worked with our partners, teacher unions, to try and mobilize teachers both in private, public and independent schools to ensure that they show up at the vaccination sites. We are working in a coordinated manner, and we've really done well so far. Education is one of the biggest sectors in the public service, and for us to be able to vaccinate so many of them over such a short period, I think we have done relatively well. There are glitches, of course, that are being acknowledged, but we are dealing with those. So there is nothing that translates into a crisis so far, and we are very happy about that.
Numbers saying, for example, 52% of teachers, I beg your pardon, wanted to be vaccinated. That number seemingly had risen in June to 76%. I mean, even if we are going with the 76% number, you would mean you still have close to 25% of teachers who would not have been vaccinated. Will that in any way affect the school program?
Well, we don't believe it will affect the school program. There were categories of educators who were given concessions by virtue of having comorbidities. And what our minister has indicated is that whilst as a department we will respect the individual rights of teachers not to be vaccinated. But as a department, in instances where there were concessions granted to these educators, if they choose not to vaccinate, then it is only fair that as a department, that concession will then no longer apply. And the teachers then will have to show up because if they voluntarily choose not to vaccinate, then it means that by their own admission, they will not be concerned about, the contracting the virus on site.
Yeah. So I mean, if we understand you clearly, you're saying teachers with comorbidities will now not be allowed to stay at home. They will now, that concession will be off the table. They will now, it will be compulsory for them to come back to work.
Yes, if they choose not to be vaccinated, yes. That's the position of the department.
All right, when we come back, we'll get a response then from SATU on that particular issue that's been raised there by Enock Rabotapi. Nomusa Cembi with us, as well as Professor Mosa Moshabela. We'll take your views as well tonight on Twitter. Conversation around hesitancy in our teachers to get vaccinated. Enock Rabotapi, Nomusa Cembi, as well as Professor Mosa Moshabela with us tonight. So, Nomusa, before the break, we are hearing from the department that those who previously had a concession to say you've got comorbidities, of course, we're in a time of a pandemic, you can stay at home, will now have to come back even if they opt not to get vaccinated. Does the union support that position?
Yes, we were informed about this, and there were discussions with the department. Yes, we do support that, because but we know that if a member does become ill or get sick, normal leave measures do apply. If you fall ill, you can still take your normal leave to say you do have a sick leave as an employee of the department. What happened when COVID started is that teachers with comorbidities were allowed to stay at home, but now, if they do not take the vaccine, they'll have to come back. If whether they take it or not, everyone will have to come back. And if you fall sick or you fall ill, you have every right to take your normal leave.
Yeah, it's not only falling ill, probably that would be the question, but is the severe illness that comes, especially that affects those with comorbidities, that would come into question, and how this would affect the schooling process?
That's why we encourage many teachers to take the vaccine so that they can protect themselves, even if they fall ill. If you have taken the vaccine, the severity of the illness will be lessened. We encourage them to take this opportunity and take the vaccine so that they can protect themselves, more especially those who have comorbidities, because they will be more protected if they were to if they take the vaccine.
Yeah. Prof, it's almost as if we're taking the position of you've got to learn the hard way. If you're not going to take the vaccine, well, this is the route that you're going to go. It's a very tough one.
It is a tough one, and you know, it becomes really difficult when you know that something is good for a person and they don't want it. But we are a country of human rights, and of course responsibilities. And so even the individual or personal responsibility will kick in where you are not necessarily accepting the state to take responsibility for your health. I do think that there's a couple of things, Thabo, to consider there. One is that it's important that teachers understand that we are dealing with the Delta variant, and that this Delta variant is spread mostly through airborne transmission. The transmission dynamics are very concerning, and the school environments in general, they are a form of gatherings by their nature. So it's very important that we understand the context we're in. We know the virus that we're dealing with and the dangers that are there. And the second thing, I think it's important that, as we said, that if people have genuine concerns about the virus, even if they are refusing to take it, let's make sure that the dialogue has happened. that they've made an informed decision. And we can attest to that, to the fact that they've made an informed decision. They are not misguided. That's important, because otherwise we are putting them at risk by bringing them into that environment, even though, of course, it is still their choice. The last thing that I think would be important, for basic education to consider, it would be whether there needs to be some sort of indemnity that is signed, or some sort of, consent. I don't know what form it will take, but indemnity might be one thing where actually it indemnifies the Department of Basic Education and maybe the organizations that are involved, that actually a member or a staff member has been informed, has made a choice, and is in writing. Because later on, when it's bad, it's easy for me to say, look, I didn't say that. I raised concerns, and my concerns were not addressed.
Yeah.
And these issues have major implications.
You're raising the question of us dealing with the Delta variant in South Africa. Now, earlier on, SART was saying they would want to see the vaccinations extended to early childhood development centers as well. Now, there's been a question around, well, we're getting the adults vaccinated, but what we've seen with the Delta variant is that children are now getting sick, as well as the hyper-infectious Delta variant is spreading through the country. How serious is that?
Really, from what we are seeing in other countries, it is concerning. It is concerning both in terms of children getting infected, but also being sick enough to be in hospitals. And yes, it might just be because of the sheer numbers, but also it is a little bit of a shift from what we've seen before. So we really have to think intentionally and carefully about how to protect children. And I think that sometimes even teachers themselves, if they feel that for themselves they may not want to take a vaccine, they should consider that they work in an environment where, should they be infected, they can expose children. And exposing these children themselves might get sick, and they are not vaccinated. We don't have a protocol to vaccinate children. And secondly, these children will have to go to households, and they could also then, pass infection to adults in the household. So these transmission dynamics have to be thought of, and there is a balancing of self-interest, but also in terms of concern and interest in the well-being of others, and it's important to consider.
Yeah. Nomusa, I'll give you this chance, and then I'll ask the Prof just to respond to what you're going to raise now, particularly the issue of fighting vaccine nationalism. Why are you wanting to put pressure on government, particularly to get vaccines from Russia and Cuba?
We felt that we should go all over the world to ensure that our people are safe. We shouldn't be restricted to certain countries. We should do our best to make sure that we get as many vaccines as possible, and ensure that as many people are vaccinated as possible. So that's why we felt that we saw no logic in restricting ourselves. We feel that the powers that be should go far and wide to ensure that we get as many vaccines as possible.
Yeah, there is this perception, Prof, that there are platforms that we are deliberately shutting out and not incorporating into our cocktail of vaccines in the country. How true is that? And particularly those two, Sputnik 5 or Sputnik V, I don't know what they call it, and the one from Cuba.
Yeah. So let me speak firstly from a point of principle, Thabo. As a matter of principle, I think that we need to consider different options in terms of vaccines. And there's no question about that. And I think we've been very clear from the beginning. You'll remember even in the earlier discussions we had about Oxford AstraZeneca vaccine, some of us were fighting very hard to make sure that we keep it. And yet, we could not necessarily avoid the fact that when you start to discuss policy, you go beyond the science. There are other interests and questions that come into play. And the issue of the beta variant really kind of played into that debate very strongly. But we are at a point where we ended up as a country, from a policy perspective, saying that we want to get vaccines that work against our variants locally. And unfortunately, not all the vaccines have been tested in South Africa. So we can have a political debate about why is it that we've got American vaccines or, British vaccines, but not Russians vaccines or Chinese vaccines. We can debate that. It's part of the policy debate. I accept it. Even though from a science perspective, it's not really a debate that I would want to get into. I do, however, want to emphasize the fact that if we are going to consider other options, we need to be clear whether we agree as to whether those vaccines have to work against the variants locally. If we can agree on that, then we can talk about any vaccine, as long as it can be demonstrated to work locally. Right now, for example, SAPRA has approved CoronaVac from Sinovac. And yet, if you ask a lot of people whether they will take that vaccine, even though it's not been demonstrated to work against the variants that are dominating here, I'm not sure how many people would want it. And yet, our policy does not does not offer choice or option. So we have to consider those things, Thabo. In principle, yes, but we need to make sure that it's appropriate for our context.
Right. Quick question for the coordinator on WhatsApp tonight. This one says, as foreign nationals working in schools, we were turned away from being vaccinated since they said our names are not registered on the system. Our principals submitted our details, but we are not registered. Why is that? And does it mean we will not be vaccinated? Enock, a quick one from you, 30 seconds if you could.
Well, the issue of foreign educators, I think it was a technical glitch on the system. For some reason, the system was not picking up the numbers on their passport, the passport number, and it required electronically generated 13-digit ID number that we had on the system. But that has since been resolved, and the system can now pick up directly using their passport numbers. And a lot of those foreign educators were rescheduled on the system, and they will be advised by their provinces to visit the vaccination site for vaccination.
Right, I thank you all for joining us tonight. Prof. Mosa Moshabela, Nomusa Cembi, as well as Enock Rabotapi. Thank you for your engagement.